Good morning, everyone. I think we'll get started. My name is Susan Blood. I'm with Northwest Hennepin Human Services Council, and we're delighted to have the Northwest Hennepin Early Childhood Network members all here. Mary Anderson is the chair, and members from that and people from the community who have come. We've invited the community to come to this meeting for the Kids Count. Information from the Children's Defense Fund. Kara Arzmendia will be presenting information on that, and Alexandra Fitzsimmons, her colleague, will be talking about the legislative issues and their effects on our communities and our children. Welcome, both of you and all of you.
Thank you, Susan. It's good to be here this morning. Thanks to everyone for coming out. So like Susan was saying, I'm Kara Arzmendia. I'm the research director for the Children's Defense Fund Minnesota. I've been here before in the past, but it's been a couple years. So I'm excited to be back again presenting information on our most recent book, the 2012 Kids Count book that was just released at the beginning of the summer. So it's been out for a few months, but not too long. So I want to kind of start the morning off talking about some of the trends that we're seeing across Minnesota, and then specifically in this area, I pulled some data for the Anoka-Hennepin areas, and I see that there's also some great information from Northwest Hennepin Early Childhood fact sheets, so you also have some city and other information I was looking at. It's really great to kind of be able to compare and contrast. And then I'm going to pass things off to Alex, and she's going to talk about some early childhood work that we've been doing we thought would be really interesting for all of you to hear, and some of the policy work that's been going on at CDF. So just to get started, the book and a lot of the information that I'm going to be referring to is the purple book over on the table. It's the 2012 Kids Count book. If you didn't get a copy, I would encourage you to grab a copy on your way out. This year's book, it's entitled Children Across Minnesota, and each year we try to take a different focus of how we look at the data, so kind of how we're going to be talking about information and messaging the data. And this year we decided to focus on greater Minnesota, and so looking at what are the trends, what's going on for families living in smaller towns and communities throughout Minnesota, so not families that are living in the Twin Cities metro area, but looking at those families that are living outside of those areas. And we did that to pay particular attention to those families living in rural poverty and rural areas and what extra challenges that brings, not only for families living in poverty, but also for those families who are right above that poverty level, that are low-income families who are struggling still to make ends meet. So certainly not in a place of economic security. And so we focused a lot of our data this year on rural poverty, and how we did that is we ended up breaking out a lot of our key indicators that we've been tracking for quite a few years and breaking it out by economic development region. And there are about 13 economic development regions in the state. And so I'm going to be talking about Region 11 today, which is the 7-county kind of metro area, to give you all a sense of kind of what's going on within this region. And then also going to be talking about Anoka and Hennepin counties as well. And so just to kind of get started with the information, and I just want to say, for those of you who don't know about us, I guess I'll give our Children's Defense Fund Minnesota, just to give a brief overview. We are a nonpartisan nonprofit organization. We have a national office. Our headquarters is sort of in Washington, D.C., and Minnesota is one of 12 state and regional offices in the country. And so the work we do is primarily advocacy and research. So we lobby at the state capitol each year. We work with community leaders in other communities to make sure that children are in the forefront of our discussions, our decision making and policy making. We do research, so monitoring trends about children and families. Part of that work is through our Kids Count project that we have. And then we also do some outreach efforts. We have a Bridge to Benefits program that some of you might be familiar with. It's an online screening tool that allows families to go online. It's a free tool. They can go online, enter some information, and see what public work support programs they could potentially be eligible for. It's a great tool. If you haven't heard about it and you want to hear more, you can come talk to either Alex or I at the end of the presentation. We can talk a little bit more about that or share that information with you. We didn't have time to include that in our presentation today. That's a whole separate hour and a half. But I know for some of you who are working with children and families directly, it can be a really great tool. Another outreach opportunity that we have is through our Freedom Schools. It's a summer an out-of-school time activity. It focuses on literacy and summer learning loss, and we run those programs in about 6 or 7 different communities in Minnesota. And so that's another area that we are doing work. And so to get back to Kids Count a little bit and talk about the data book this year. So we had focused on, as I was saying, our kind of messaging and information on Greater Minnesota this year, but I think a lot of what we found in the literature and in the data as far as families and children in Greater Minnesota can be applied to other areas as well. And particularly when we're talking about this issue of poverty and children and families who are living in poverty. And what we find that when families are dealing with low income or living in poverty, that they have kind of extra struggles or issues, barriers if you will, meeting their basic needs. And sometimes, due to the place that they call home, meeting their basic needs can be even more challenging or more difficult. So families that are living not in a central location, and this can apply to suburban areas as well, transportation can be more limited. You have to have a car to get to where you need to go. Their housing can be limited. There can be more stigma in a smaller community where you know everyone. There can be a lack of grocery stores or healthy places or places to purchase healthy foods, a lack of healthcare clinics. The job opportunities might not be as plentiful. So these are some of the extra issues I think that families who are living outside of an urban center are dealing with, an extra barrier on top of already dealing with a low income or poverty status. So that's something that we found in our literature and the research that we looked at. And really what it started to form for us is kind of this intersection between access and affordability. And that kind of became this message that became very clear looking at the data and looking at the literature around some of these issues. And then it's really this interplay for a lot of families being able to access and then afford goods and services so that they can provide for their families. And I think when we think about, I kind of coined this as the family dilemma when thinking about these issues. And for all families, I think the question becomes, if they can afford it, can they access it? So do they have a health clinic in their community that they can go to, or do they have to drive long distances in order to find a doctor or a dentist that's willing to see them? And I think that's an issue across the board, no matter what a family's income level is. But then when we have the extra burden of poverty on top of that, or low income status, it becomes an issue of, if they can access it, then can they afford it? So if there is a health clinic in their community, does their job that they have provide critical health care benefits? So do they have health insurance so that they can go and access that clinic that's available? And it's sort of the interplay between these two pieces. Do families have both access and affordability to then be able to provide for their families? And I think that's really important. And then, like I was saying, with the extra barrier of poverty, it can make accessing and affording goods and services even more of a challenge. And I think for a lot of people, when we run around the state and we're talking about the book and this data, a lot of people don't think about child poverty as a non-urban issue, that it is a rural issue in Minnesota. And I think people think that poverty is very concentrated in certain places, in certain neighborhoods, and that if we just avoid those neighborhoods, that we'll be okay. But you can see through this map, and this map is also in the book, the darker shades, this is by economic development region, and the darker shades signify the higher percentages or the higher concentrations of child poverty in our state. And so you can see sort of the further up north and into the central region of our state, that's where we really see the higher levels of children living in poverty. And so the highest rate is in region 2, it's at 26%. So in that region, more than 1 in 4 children is living in poverty in region 2. And then in the lowest region in the state is in 7W at about 10%. And that, just so you know, kind of geographically, that's the St. Cloud region, so that area there. And in region 11, it's about 18% of children living in poverty, which is above the statewide average of 15%. And this problem has been growing, certainly has been growing over time. You can see since 2000, we've had a 70% increase in the percent of children living in poverty. So you can see we started the decade at about 9%. That was about 114,000 children living in poverty. New numbers, 2011 numbers from the census came out just a few weeks ago, and that number has grown. So from 114,000, we're now at 194,000. So we've seen about 80,000 children fall into poverty over the last 10 years. which is a huge increase. I think the silver lining sort of, or the one positive thing we can conclude from this, looking sort of at this chart, is that the growth from 2010 to 2011 was pretty much the same. So we're hoping now at least maybe families are stabilizing a little more, that they're not, there's not more children that are falling into poverty, which is a good thing, that it's not continuing to go up, certainly not as sharply as it has been over the past few years. So we're hoping that once families get stabilized and maybe there's some more job growth and families get into a better position, then we'll start to see these numbers go in a different direction. But your guess is as good as mine as far as what will happen in 2012 when new numbers come out. And you can really see that from 2008 to about 2010, so that's when the start of the recession hit, you can really see a dramatic increase in the percent of children living in poverty. And that really is, I think, reflective of the recession, the economic downturn, and what was happening for families with jobs and unemployment and cutbacks and those kinds of things. So children really did see the effects of the recession. And you can see that through the graph. And if we look specifically at Anoka and Hennepin, what I think is striking is these are child poverty estimates also over the same time period. We don't have 2011 numbers yet. We will in a few months. They always start with the state level estimates and then work their way down to the smaller population sizes, so I only have up to 2010. But you can see, I mean, if you just kind of toggle back and forth between these two, I think the trend overall, if you're just kind of looking at the overall line, is very similar to what was happening in the state as a whole. So you can see a sharp increase starting in 2008 for the recession, and then has sort of continued to increase since that time. But the overall trend has certainly been going up. More so in Hennepin County than Anoka, but I think that's sort of to be expected. And both counties have child poverty rates. Well, Hennepin County no, but Anoka has child poverty rates lower than the state as a whole. So just something to look at and to compare. And then if we look at child poverty by age, this Alex is going to talk a little bit more about later on in the presentation, but you can really see our most vulnerable group of children is really in that lower age range. When we break it out, the bar on top is children 0 to 5, and you can see that they experience poverty at higher rates than the rest of the child population. And that's been an area that we've really just tried to focus our policy efforts and our work at the Capitol and in the community, that we're seeing that these really are our most vulnerable population, and knowing what we know about the growth and development that's going on during that time period, we feel that it's even more important to be focusing in on that age range and that group to make sure that they have what they need. And of course, whenever we're talking about child poverty, children are poor because of their families, right? Their family's economic situation. So children are poor because they're living in poor families. And so another area that we looked at is a family's ability to afford goods and services. And a way to do that is through the median family income. And what I like about this particular indicator is that it's what cuts the family incomes in half. So the median is right there at that 50% mark. So we're not talking about families at either extreme that are very poor or that are very rich. It's that one that cuts the group right in half. So we're really looking at those families that are right at that 50% line. And you can see that, much like the poverty numbers, that there are big differences across our state, and that again, the higher the number is the darker the shade for Minnesota. So it's kind of the opposite of the child poverty rates. So you can see that in Region 2 and in Region 5, they have the lowest median family income. It's about $50,000 a year. The highest is actually in this region, Region 11, at almost $85,000 a year. It's a huge difference for families and what they're able to afford, the goods and the services that they can provide for their families. It's a difference of almost $35,000, which I think has a huge impact on the kind of housing a family can live in, the kind of nutritious food that they can afford, the enriching activities that they can provide for their children that'll prepare them for school and beyond, their access to things like health services. So with such a range across our state, I think it's no wonder that we're seeing children living in different situations in different places. And then this is looking at that median family income. Again, this is the statewide. This is looking at it over time. What I think is also interesting is that families really have been making less over time when we look at the median family income and we adjust it. This has been adjusted for inflation. So you can see that from 2000 to 2010, families really have been on this sort of downward trend. So they're really taking home less money each year. And it's a decrease of about $1,300 from 2010 to 2000, so over the last 10 years. It's a decline of about 2%, which we know, I'm sure I don't have to tell all of you this, that many of the costs that we've seen have continued to increase. So childcare costs, tuition, food, gas, all of those things certainly haven't been on a downward trend, really forcing families to try to figure out how they're going to do more with less, what trade-offs they're going to have to make in their budget in order to make ends meet. So I think this has real consequences for families when they're trying to be able to provide for themselves and their children. And then I just wanted to explore a little bit. There's a lot of examples in the book really talking about this issue of access and affordability. And certainly a cost that hasn't gone down over the last decade or so is childcare. And so I kind of wanted to just talk a little bit really briefly about childcare and looking at access and affordability for families. I think that childcare is a really good example as a work support for families. Families can't work if their children aren't in care, but then there's also the child development component of childcare, that it needs to be a safe and a healthy place, a quality place for children to go so that they can be in an environment that's supportive of their developmental needs as well. So I think it's a really good example. Unfortunately, Minnesota has historically had some of the highest costs childcare in the country across all age ranges. According to the National Association of Child Care Resource and Referral Agencies, Minnesota has either been number one or right up near the top. We're always kind of trading places with New York and Massachusetts as far as our costs of care. So families really do struggle to be able to afford care, especially quality care that are going to be good environments for their children. I think a good thing about this is that in Minnesota we do have the Child Care Assistance Program, which allows families who are working or going to school to get help with child care, receive subsidies so that they can go out and find places for their children to be while they're at work. Unfortunately, this program it's not an entitlement program, which means that once the money is gone, families are then put on waiting lists, so they can't access the program even if they are eligible. Even if they're deemed eligible, they're put on a waiting list, and I think there's over 7,000 families right now that are currently waiting for childcare in Minnesota. So it's a program that is a good thing, but certainly has some opportunities for improvement. And this is looking at families' ability to afford childcare. This is looking at family childcare providers who accept the CCAP assistance, the grants that I was talking about. And the good news is that, statewide, the majority of childcare family providers are willing to accept CCAP, about 80%. You can see in the northern regions, it's even more than 90% in some places. Region 2 has 94% of providers willing to accept the subsidy for families. So that's a great thing, that most are willing and open to accepting that so children can have a place to go. In Region 11, it's a little lower, but still the majority of families willing to accept that. Oops, I'm going to drop my packet here. But like I said, unfortunately for many families, if they aren't lucky enough to receive the funding, if they're living in a county that has a waiting list, they can be waiting months and months before they can get that care. And so families might have to pay out of pocket thousands of dollars in order to get care for their children. And I think I brought county fact sheets today from Anoka and Hennepin County that breaks out the child care costs by age range, so you can kind of get a sense. But I know, for example, statewide care for an infant in a center is almost $14,000, and that's just the statewide average. So we're talking about real costs for families who are making low wages, who aren't making a whole lot of money. They certainly end up paying a huge portion of their costs in child care. And then the ability for families to access childcare. This is looking at family childcare providers who offer non-standard hours. And non-standard hours are defined as care that's offered before 6 a.m. or after 6 p.m. or on the weekends. And as you can see, unlike family providers who are willing to take the CCAP assistance, there aren't as many family providers who are willing to offer care during non-standard hours. There's only 15% of providers statewide. In Region 11, it's 8%. That was actually the lowest in the state. And it goes up to, in Region 70, about 29%, so almost a third in that area. And I think the takeaway from this is for a lot of families that are working low-wage jobs, this is when they need care. They need care at nights and on weekends because they're working in restaurants or they're working in retail or at convenience stores. And it's the out-of-school time hours where they need a safe place for their children to go. And I think that what ends up happening is the consequence of this, and we're seeing that even more so in greater Minnesota and rural areas, is that families have to depend on family, friends, and neighbors to kind of piece together a child care situation for their children. Which, while it can be a more flexible option for families, a lot of times that can, because it's not licensed care, it's not being monitored by the state, there's no guarantee that it's going to be a quality environment for children to go. So that's certainly another trade-off that families have to deal with and think about when they need to get to work and find a place for their children. And then I looked at the ability for families to access and afford child care in Hennepin and Anoka County. So the darker bar, sorry you can't see it, the darker bar is family providers who are willing to accept the CCAP program, like I said, and then the lighter shade of purple bar is family-based providers offering non-standard hours. And both of these I thought were interesting, were lower than the statewide average. Certainly the majority of providers being willing to accept CCAP and only a small percentage offering those non-standard hour care, but both were below the statewide average on that. So I thought that was kind of interesting. And then just want to kind of wrap up my portion of the presentation talking a little bit about some highlights of Region 11, taking a closer look at the metro area, and then talking a little bit about some other facts that I thought were interesting from the county fact sheets that I brought today. And so Region 11, I'm sure I don't have to tell you all, it includes the 7-county metro area. There's some major cities in our region. And if we look at just at a glance at Region 11, it was the lowest for children without health insurance. So 5.8%, the state average is 6.7%, which is a good thing. I think this has to do with outreach efforts in the state are more concentrated in the metro area. There's more organizations that work with families. I think there's more resources here, so that might be some of the reason why the 7-county metro area has a lower percentage of children without insurance, that there's the access piece, that families can access help and assistance in order to get connected with insurance. It was also the lowest for family providers who accept CCAP, which I talked about before. The lowest for family providers who offer non-standard hours, 8% versus 15%. And then it was the highest for children receiving SNAP, which is the food stamp program, or was formerly called the food stamp program. So 22% of children in the 7-county metro area, so almost 1 in 4 are receiving SNAP. The median family income, which we talked about earlier, so you can see the difference there between the state average and then in this region, it's still quite a big difference. That was actually surprising to me, that it is as high as $84,000. And then children arrested for a serious crime is quite a bit higher than the state as a whole. And then lastly, students with limited English proficiency, probably due in large part to the different cultural groups and immigrant groups that we have in the metro area compared to the rest of the state. And then I just wanted to talk briefly about some things that kind of jumped out at me and I thought were related to education and possibly indicators that you all track in your work. This is looking at free and reduced price lunch in both Anoka and Hennepin County. And as you can see that since the beginning of the decade, this has been on a steady increase, the number of children, or the percent of children receiving free and reduced price lunches in both counties. I know this isn't district data, which probably would be more helpful because I know the Hennepin County includes Minneapolis, which is hard to separate out. I'm sure they're driving a lot of the higher percentage being over and above Anoka County, but I thought what's interesting is the trend that both counties have seen this increasing trend over time. And then looking at educational attainment in both Hennepin and Anoka County, the darker gray bar are graduation rates, and these are four-year graduation rates. And then the smaller gray bar, lighter gray bar are dropout rates. And these aren't going to equal 100% because there's two other categories that I didn't show. One is for students that are continuing their education, so they're taking 5 years to get a degree, or they're going on to get their GED, some other form of education. And then there's also a small percentage of unknown that either move away or they lose track of within the district. So that's just something to look at. And I think Anoka County had better percentages than the state, and Hennepin was a bit below. Are there any questions about this information? I know I've kind of touched on a lot of different things and thrown a lot of stuff at you. Yeah.
What are some of the major factors that contribute to childcare being the highest, like, compared to other states?
The cost being the highest.
Why won't California be higher with their cost of living being higher? It doesn't track just that, obviously.
Yeah, it's really interesting. I've heard sort of just anecdotally that that our licensing standards might be higher here, that we might do more with that. I'm not really sure if that's true or not, but I have heard that as one of the reasons why that might be the case. What I think is interesting, so I don't have a really good answer for you. That's one thing that was presented to me that I thought, oh, that might be. I haven't looked at different licensing standards across the state, and the National Association of Child Care Resource and Referral Associations doesn't really give a clear reason as to why there are such differences across the states for care. What I do think is interesting, though, is that I talk about the high cost of child care, but I think it's important to just mention, too, that a lot of times that the high cost for parents doesn't translate a lot of times into high wages for providers, and that many times providers are making wages that are below, that keep them in poverty themselves, that they're not able to make a living wage as child care providers. So it's an interesting, you wouldn't think that to be the case with families paying thousands and thousands of dollars a year for their care, but it is certainly not an area where providers are making a lot of money then on the flip side. So it's kind of counterintuitive to think about. But yeah, Dave.
One of your early charts showed the poverty rate.
Yes.
Showed between 2003 and 2002, 2003 that it dropped rather substantially. I'm wondering if we know from history what happened there, because a later graph showed that the income per family dropped during that same period as well. So it wasn't that income went up. I'm wondering, do you know what happened at that point, and can we make that happen again?
It was my understanding, if you look at, I think the economy at that time was doing better for those few years. I think,
I wondered that too, but if you go ahead a couple graphs to the income,
yeah, so the income
dropped.
it did start to drop, but it was higher in 2000. I guess it peaked in 2002, and then if you look, sorry, I don't mean to be flipping back and forth. In 2002, this peaked and then started to drop. So there was something going on in that period. I don't know if these will track directly on top of each other, but certainly something was happening where families had been earning more and then children came out of poverty. I think, sometimes the timing isn't direct, but certainly I would say that the economy had something to do with that slight drop that we see. But no, I don't have any. I don't know if all of you have thoughts about that at that time period.
September 11th, was there in blood.
Yes.
Right after that, there was a, a dip, in the economy.
Mm-hmm.
When I think if you look at 2008, with the housing bubble, the same type of things. Doesn't show it right there.
But yeah,
Yeah, that is a good point. That there was a.
go up.
Yeah.
The housing bubble was more like 2008, wasn't it?
Yeah.
Yep.
That's where,
And I think
That
the
makes
impact of that was kind of gradual too.
And these things, like you're saying, they do take time. I think for a lot of families, what they try to do is they'll use their savings, they might get a second mortgage on their house, they'll try to, sell a car or do whatever they can to kind of keep themselves afloat for as long as they can, spend down retirement, those kinds of things, and then they find themselves in a bad situation, thinking that maybe, oh, my spell of unemployment, I'll find another job, or I'll get, something to kind of that'll make up the difference later on. So they'll make those kinds of decisions, thinking it won't be a long-term situation, and then once it ends up taking a few more months or being longer than they expected, then we see the poverty numbers. Then they'll fall below that line. So I think it does take some time. That's why you might not see the direct matchup between the income and the poverty rates. So. All right, are there any other questions or comments? I think what I'm going to do then is turn things over to Alex, who's going to talk a little bit more about some different research and some policy things that have been going on that are very exciting.
Thank you,
and I have to
Kara.
do this.
I'm going to do
a
the
quick
handoff.
Quick switch.
Thank you. Well, good morning. I'm glad to be here with you today, and it's always hard to follow Kara. But that being said, I'm going to talk with you a little bit about the policies that we work on at CDF, and really focusing today on the early childhood policies. But just to let you know, at CDF we do advocate for children throughout their childhood, so until they become adults. But again, just for today, to focus on some of the early childhood policies that we're looking at CDF. Just a way here to root our work about just how important it is to look at our community and how our community is treating children. And certainly from the numbers that Kara shared today, we know that our children aren't doing well, so we need to figure out how we change that. And also, as Kara shared, why we're focusing on early childhood is because when we look at our children in Minnesota, we know that our youngest children are having greater rates of poverty than our older children. And also because we know so much from research about how harmful the effects of poverty are on children, especially our youngest children. And so when we look at the environment, we look at the environment creating these toxic levels of stress. And I know I'm in a room here of experts, so I'm not going to spend a lot of time on this piece, but just to let you know where we base our policies. So we have the data, but then looking at our other research. So we know a lot about these toxic levels of stress. And so we know too that when parents are under stress, and if they're having a difficult time making ends meet, they don't know how they're going to pay their rent, they don't know how to pay their mortgage, and they're worrying about these things, how they're going to provide meals, that causes stress on mom or dad, which can in turn cause stress on a child. And then also when parents are dealing with so many different obstacles in their lives that it's difficult for many parents to parent in the way that they would like to parent. And so we have that piece. Then we also have the piece when we look at toxic stress within a child, and that toxic stress can affect their development. And so when I talk about toxic stress, I'm not talking about this daily stress that all of us have to some degree, which is normal and healthy, but it's this toxic stress, it's this heightened level of stress where a child is in this situation and is actually impeding brain development, that we know that there are hormonal changes that are happening at this time that can actually alter the pathways that are being formed in the brain. So that's the toxic stress we're talking about, and that's why we focus our policies right now at this period of time on really trying to make these arguments about why we need to be investing in early childhood and why this is the place that we need to be right now. And just a picture here of a normal neuron, and then one below that's been, we can see, impacted by this toxic stress, this cortisol that actually gets increased and is responsible for changing these pathways. So we see on the top that normal cell, you have all these, it's more colorful, it has more pathways, there's more firing, and then we have the one down below that has fewer connections because it's been damaged, and could be damaged for many reasons. But again, looking at that biological process related to these adverse experiences that children are having. And so when we also talk about adverse childhood experiences, we know about this research that came out of Kaiser Permanente. They did the study between 1994 and 1997 in California. We've been hearing a lot more now about this research from Dr. Anda and Dr. Folletti. And that research was when they had surveyed 17,000 adults in California, and they voluntarily then shared this information, but they went in for their yearly physical, they had their physical, and at that time they were also asked, will you fill out this questionnaire about your childhood and what your experiences were. So there were questions about poverty, about abuse and neglect, about witnessing domestic violence in the home. And they found, so here what we have, and I'll bring all of them up right now, but what we have here is that down below, so on the horizontal axis, you see the number of ACEs. So these are those adverse childhood experiences. So the ones that they ask the questions about. Most of us have at least one. But they found that as the higher number of ACEs that somebody would self-report as an adult, the greater likelihood, for example, here we see the greater likelihood of self-reporting of alcoholism or use of drugs. And they also found relationships with heart disease, with diabetes, with obesity. So they could connect those things with those experiences in early childhood, with physical, with mental health outcomes as adults. So that information is very powerful, and I know that many states, more than half of states now, are bringing the ACEs and bringing this way or this tool for making those connections. So Minnesota, I think, started getting involved in a formal way about a year or two ago. So we now have brought that information here, and we're starting to collect that. We also have this growing understanding of the importance of these protective factors, so these buffers that can help when children are in situations and experiences that are stressful. And we know that these 5, if we have these in place, are really important for combating the effects of poverty and other harmful childhood experiences. So we know parental resilience, very important. Secondly, looking at the social connections. What connections does mom or do mom and dad have, or mom or dad, the family? Do they have someone that they can talk to? Are there family members? Are there community members? Is there that support system, the schools? When schools are involved, especially since we're talking about younger children, but then looking too at knowledge of parenting and child development. Are the expectations that mom or dad have for their little one, are they reasonable? Are they expecting that they're going to walk at 6 months, and we know that that's not developmentally appropriate? Do they know consequences, and understanding all of that, and again, the developmentally appropriate piece of that. The fourth is that they have access to concrete supports when they need them. So if they're worried that they're going to miss a rent payment, a mortgage payment, that there's somewhere that they can go. Same with a utility bill, food. Are these supports in place? Do we have a safety net in place? And then lastly, is actually the social and emotional competence of the child himself or herself. And this just, I'm trying to be conscious of time here too. We have time, but I want to be conscious of your time, and if there are questions, and want to get into some of the policies we're working on, but looking here at outcomes, so that again we know when we look at poverty level and we look at moving out of that, and I'm sure people already know this, but just when we're talking about poverty, we're talking about $22,000 a year for a family of 4. So looking at when we get above that we see better outcomes, so it's not a surprise, but more years of schooling completed, earnings are greater, health outcomes are better, fewer arrests. So looking at those different pieces and how income directly relates to health and well-being. One of our favorite pictures at CDF, because there's so much happening in this picture, but the importance of attachment and bonding, and then all that we know about this little boy and his brain development, all of the things that are happening during this very critical period of time. So getting now more into some of the policies that CDF is working on and that we'll continue to work on next legislative session, we look at the BUILD initiative and these 4 components that they identified in what makes a healthy, effective early childhood system for a state to have. They're working with a few states, Minnesota is one of them, So again, not going to be a surprise, but the importance of support, of parenting support, of economic support for families, early care and education opportunities, making certain that those are available, a comprehensive health system. So the medical piece, the nutrition piece, the mental health piece, the dental piece, all of those pieces that we're getting that preventative piece early on. And then lastly, making certain that we are identifying our children as early as possible who are showing signs or who are at risk for developmental delay. And that's actually an area we spend a lot of time on and a lot of focus on, is really identifying early. So the last piece before getting into the policies is that, again, relying a lot on the research. And so there was some more recent research, and this was the table we saw a few slides ago, that really shows that one way, and a very powerful way, that you can improve outcomes for children is to improve the financial stability, the financial security of families, that there is a direct correlation.
What does casually related to?
Oh, causally.
Excuse me, I read it wrong.
Yes.
I don't know.
So, so making those connections, so looking at, making certain that the supports are available, and then these are the different policy areas then that we work on, looking at our MFIT program, which is our cash assistance program. It's often called our welfare program. There are about 100,000 Minnesotans who receive MFIP assistance each month. 70,000 of them are children. And so when we go out and we talk with people in the community, we talk with legislators, that's often a surprising fact for them, is that we're really talking about children. And then looking to just at earnings, looking at our minimum wage. Minnesota has the third lowest minimum wage, state minimum wage in the country. So looking at that and what it means for families, especially knowing what we know that families need to be able to make it. What does it cost to live? What does it cost to afford basic needs? And then lastly, looking at training and education. So when we look at our policies, one of the pieces that we look at is we look at the systems, and we look at the systems that children are already involved in, and we look at the overlap of those systems as well. So children who are in the child protection or child welfare system, and really also talking about abuse and neglect and how neglect is much more prevalent than abuse, and also looking at the connections between neglect and poverty. So if we solve poverty, we're going to see a tremendous impact on the number of our children who are in the child protection, child welfare system. Secondly, looking at children who are homeless. It's a huge number of children who are homeless, and it's about a third of Minnesotans who are homeless are children, and over half of them are under the age of 5. Third, looking again at the MFIT program. And then lastly, children who have a parent who have an undiagnosed and untreated mental illness. We have many great services, many great programs that are effective, that are evidence-based, that we know work. We just have to make certain that our children have access, which again is a common theme here, but that our children have access to these programs. One of the pieces that we worked on last session, we worked on trying to expand Part C early intervention services for children who were reported for abuse or neglect. So in our child protection system, we have the 2 tracks. And we have an assessment response and we have an investigation response. And most responses go through this family assessment track, which is less adversarial. It's a strengths-based approach. We come in and we look at the family and say, okay, here's what the family's doing well. So it's used in the majority of cases. And why that's important is because there's no determination if abuse or neglect has happened. It's not substantiated. Whereas on the investigative side, that's for more severe cases, so it would be sexual abuse, it would be severe physical abuse, kidnapping. There is a determination. They substantiate the abuse or neglect. And why that's important is because there's a federal requirement that infants and toddlers who've been in a substantiated case, so who have gone through this investigation, the investigation track, that they be referred for an early intervention screening to see if they're meeting developmental milestones. Well, what we know from the research, and research based in Minnesota as well, is that children who are reported also have similar outcomes to children who have that substantiation. So what we wanted to do is we wanted to make certain that all children then who were reported, so if either track they went through, that they would be referred for the screening. And that screening is voluntary, but we know that the earlier we can intervene if a child is at risk and is showing these signs, the the greater likelihood we have of helping earlier to get back on track. And I share too, on that piece, that we also talk about a study that was done at the University of Minnesota through MinLink, where they tracked children who were receiving Part C, these early intervention services, that they had received them, sometime 0 to 3, and by 2nd or 3rd grade, a third of them did not need special education services. So we took the research, we took that MinLink study, and we went to the Capitol and we said, here's why we need this, here's where our children are, here's what we know how to do, let's figure out how we can do this. So what happened this last session is we made some progress. We'll come back next session and go for that expansion again. And just so you know, we're talking about 5,000 infants and toddlers who would qualify or who would be covered then. And so what we know and what happened this last session is that now it's in statute that a county protection worker would have to make this referral. So it's in statute now. It wasn't in statute before. And we're also having, we'll have information beginning in 2014 about the number of children who are referred. We didn't have that information. So we'll have county information on the number of referrals that are made. So just an example of some of the policy work. So as far as the legislative session went for 2012, we talked about this first piece, the Part C, the early intervention. We'll come back again this next session and really advocate for that. And we're hopeful that we can move to that place where we can expand access for children who we know who are at risk. Secondly, we have a large maternal depression act. We're really trying to focus on much of our work. We have this 2-generational approach where we focus on mom and dad and the child. And so this is a perfect example of a policy that brings that to the forefront. So we have a maternal depression act that focuses on mom and focuses on baby, because we know that 1 in 10 new moms are suffering from maternal depression, so not baby blues, but maternal depression. And we also know that it's highly treatable. The other piece we know is that when you have depression, it's very difficult, if not impossible, to be able to have the relationship with your child that you want to be able to have. And so being able to respond to baby's coos and baby's cries and just this close relationship that needs to be happening at the time is almost impossible if you also have maternal depression on top of being a new mom. So really looking at what can we do to make certain that moms are being diagnosed, that they know about maternal depression, that they know, no, this isn't normal, there's something that we can do about this. So many different pieces to this act. One piece that we got through this session was actually doing some outreach at WIC clinics. So now WIC clinics will be required to provide information on maternal depression. So here's some signs to look for, here's some symptoms, here are some places that you can go. So having that referral available as well, because we also know that almost half of moms will use a WIC clinic at some time in their lives in Minnesota. So it's a place that we can really get to moms. And then lastly, we have a visible child work group. We're really trying to address the well-being of children who are homeless, again focusing on our youngest children. And right now we're in the process of convening a work group at the Capitol. So we have legislators, we have housing providers, we have child advocates, we have business and philanthropic members, and we're coming together to provide a framework for a plan, that this is how we serve children where they are, if they're in shelter, and they're in transitional housing, they're in supportive housing. But this is how we make certain that their well-being is being addressed, in addition to all of the other things that these little ones and their moms and dads are facing. So really trying to come up with this framework so when we begin session in January, we can hit the ground running and say, okay, we have these pieces, we have our goals, we have our objectives, we maybe even have some programs identified, but just to give you an example of looking at perhaps having a behavioral assessment or behavioral screen, that when a family comes into shelter, that a child would be screened right away. And that would be an opportunity to then refer to any services that they would need. Because right now, it's a crisis situation. And what happens is you're so focused on stabilizing the housing piece that we're missing out on some of these other major components of a child's well-being. and maybe looking at some childcare options, maybe looking at family home visiting. Are there some models that we have that we can use that would be effective with families who are in that transitional place of not having a home? Other legislation that I'll briefly focus on, very briefly, we talked about the MFIT program, but looking at addressing well-being of children who are in the MFIT program. So the focus of the MFIT program is on getting parents to work and really looking as parents as workers, not looking at adults as parents. So trying to focus on that piece, but also focusing on the fact that we have 70,000 children who are receiving assistance through this program and about 35,000 children who are under the age of 5. So what can we do? And this legislation actually went very far. It was in the House Omnibus Big Health and Human Services bill. It got taken out during conference committee because the Senate didn't have it in their bill. But really looked at how do we get information to mom and dad at the orientation into MFIP, at the employment reviews. Can we look at some maybe child care options for child-only families who don't have any other child care? There aren't any early childhood opportunities for these children. What can we do there? Making certain that, again, information is available on development and what's appropriate for development and the importance of the early childhood screen. So getting all those pieces in when we have families at a place where they're on their way. Things are looking up, and they're interested in getting the information they have. Oftentimes we talk with families, and they'll be surprised about certain programs. They'll be like, I didn't know that program existed. How do I find that program? How do I talk to somebody? So really trying to look at seeing children and making children visible in the many programs where their lives are touched because mom or dad is being touched by a program and being served by a program. Lastly, this is the Family Economic Security Act. We work on this in coalition with the Jobs Now Coalition, the Joint Religious Legislative Coalition, and Childcare Works, and this is really focusing on that economic security piece of improving outcomes for children by increasing the financial stability of families. So it increases the minimum wage, it expands child care assistance, funding for child care assistance, and increases eligibility. And it also does some work with tax credits, because we know that when those three pieces are together, but especially the minimum wage and tax credits, that's what lifts families out of poverty. So figuring out how do we move this, how do we get this through, and those three pieces, just so you know, we picked because there was a bipartisan commission, the Legislative Commission to End Poverty, that met in Minnesota over about 2 years, and they released a report in January of 2009, and it was a roadmap that said, here's how we end poverty in our state by 2020. The most robust package of policies that they had were the pieces we've included in this Family Economic Security Act. When they did those three things, and there were two other pieces I'll just tell you about too so you know, but when they did those three things, they were able to, and when I say when they did those three things, when they simulated them, they simulated what these policies would do, they were able to decrease poverty in Minnesota by 27%. They were able to save the government, our state government here, $2.6 billion in savings, and there were 35,000 workers with new jobs. But the other two pieces that were included in that simulation, one was an 85% food support participation rate, so the number of families who are enrolled in food support or now would be SNAP, and we're at about 67% now. They assumed an 85% rate. And then the other piece were some training and education for adults under the age of 49. So that would definitely have a correlation then with the 35,000 new jobs, or 35,000 workers with new jobs. So that's something that we're really focusing on and going out into the community and really talking about, what does it cost? What's a basic needs budget? What do families need? Just, again, bare bones, what do families need to be able to support a family? Talking about what a living wage is and trying within, that spectrum of figuring out, okay, what do we need to do for families? But the thing is, we know what we need to do for families. So building the consensus that this is the right thing to do. And the other piece that I'll share before wrapping up is that we know that there are often concerns about minimum wage and the effect of increasing the minimum wage and what it will do to small business, what it will do to local communities. And there was research that was done out at Amherst in 2010 that looked at a minimum wage tipping point. So that wage where you could begin to see effects on the local economy. And they put that tipping point at $12.30 an hour. So our federal minimum wage is $7.25, our state minimum wage is $6.15, and as I shared, we're the third lowest in the country. What this bill calls for is it calls for a $9.50 minimum wage for large employers. It's $8.25 for small, and then it's $7.50 for that training wage, that 90-day training wage. So that's what we're pushing for.
What industries actually pay
Well, the restaurant industry is a big one. Restaurant, hospitality, those would be the two major ones. So often with that question, we look at where our bordering states are, and we look at oftentimes conversations that come up about a tip penalty or a tip credit where servers and wait staff their tips would then count toward the minimum wage. That's something that at CDF we wouldn't be supportive of, because we talk about the minimum wage being a floor and not a ceiling. But so to answer your question, though, it primarily be hospitality. So I will leave you with what can you do to advocate for children, since we are coming up to an election here in less than 4 weeks.